Hello, hello, hello. I hope you are having a wonderful day, and I hope you're not in too much back pain today because we're talking about low back pain. And so, if you're watching this video, if you're taking the time to watch, then you probably struggle with some back pain, low back pain. It might be like upper back pain. This will apply to any kind of back pain, but I'm specifically going to be talking about low back pain, specifically when it's like really low, like right at the base of your pelvis, where you're like, is that my pelvis? Is that my low back? Like, what's going on right there? So, um, I want to talk about low back pain and actually overstretching and like when to know if you should stretch, when to know if you shouldn't stretch, right? It can be so confusing, especially when it's really achy because it's achy and so it feels like you want to do something to make it feel better. And oftentimes, uh, we'll just kind of like start stretching just to try to get stuff to move around, right? Without any real, um, like, more sophisticated theory about why, other than that. Um, and then a lot of other things can happen. Like we'll go to the chiropractor and maybe they give us an adjustment, um, or tell us to do a stretch or something, but it still might not really help us understand for ourselves, like, how do you know if something needs to stretch? Right? It's a good question. Okay, so thanks for joining me. My name is Linnea. I am the owner and founder of Limber Arts, Pilates and personal training here in Olympia, Washington. And I've been teaching some kind of movement, fitness, circus, acrobatics going back uh, over 2 decades now. And, since I actually really retired from being more actively in kind of the circus and doing aerial acrobatics, I've really been focused on more therapeutic movement. So I've been really focused on therapeutic Pilates, therapeutic yoga, healing my own injuries, and helping clients to do that as well. Basically, since about 2012, 2013 now. So a little bit of a while now. So, yeah, thanks for joining me. Let's get right into this. So, let's talk about the shape that your body's in, right? How do you know what shape and specifically your low back, right? How do you know the shape that your low back is in? And if it's in one kind of shape versus another shape, then that might help you understand if you need to stretch it, right? If we're talking, I'm trying to make this really simple, right? So I'm kind of like thinking about the words that I want to use, because I don't want to be too anatomical about it. But if we just kind of think really, really simply as any kind of movement in the body could be described as like an opening or a closing. Let's just say that, like any muscle, any bone, any joint, any fluid, any whatever, any opening, it's going to be able to have sort of a time when it's more open and then a time when it's more closed, right? And so, what does that mean when it comes to low back pain and stretching, right? Well, so stretching is definitely a lengthening kind of a thing, right? And so, a lot of times, what I see people doing, what I see my clients doing, is more like it hurts, so I'm going to stretch it. And that's really different than understanding, like, oh, it's closed, so I need to open it. And that would be a more desirable, in my mind, a little bit more of a desirable mindset to have, to be able to understand, oh, this muscle in my body, it's kind of stuck in a more closed position, and so I need to stretch it to open it and lengthen it. But in order to be able to think like that, we have to know, right? We have to know, like, oh, is that area of my body closed or is it open already? Because actually, so here's what's interesting, right? A lot of times, muscles will hurt and they'll ache and they'll be stiff and they'll feel tight when they're actually long and stretched. If you think of a rubber band, right? If you think of a rubber band that gets pulled apart and it's never allowed to actually slacken, if you think of a rubber band that's just always pulled apart, like, that's a lot of work. it wants to come back together, right? Like it naturally just wants to close, but it's not allowed to close because it's just always getting pulled apart. And so we call that tension or tensile. I think of it as like tensile strength, but it's a tensile reaction as opposed to a compressive reaction. So it's a type of lengthening or loading, and that can make a muscle really grumpy. And if your muscle's really grumpy because it's long and stretched out and never gets a break, and then we go to stretch it, that's not necessarily going to help, especially if we're not stretching it in exactly the right way. Because there is a sort of a way where you can stretch it to kind of help boomerang it back to give it some relaxation. But again, I'm not trying to go there. I'm just trying to talk really simply about like you want to stretch the areas of your body that are more stuck closed, and you don't necessarily want to stretch the parts of your body that are like already overstretched, even though sometimes they might feel like they need something. And so we're like, well, how about let's stretch it? Okay. So I hope this is all making sense, by the way. Drop a comment if this is making sense, right? I'm trying to speak really simply. I'm trying to make it somewhat intuitive so that you can even just start to put the pieces together and be like, you know, oh yeah, that area of my body is kind of like compressed versus like long and open. Um, okay, so how do you know, right? How do you figure that out? Because if you go to a yoga class, if you go to the chiropractor, if you go get a massage, like 9 times out of 10, in my experience, there's not a lot of like educating that happens, right? There's maybe a lot of treatment that's happening, there's maybe a lot of instruction that's happening, but it can be a lot of like, just trust me, I know what's best, just do what I say. And so I really strive to empower my clients and my students to gain like real knowledge and understanding in a very practical and useful way that is easy for you to then kind of continue to use for the rest of your life, right? So, how do you know? How do you know? Um, it is tricky. I'll just say that it is tricky. And I think this is, just for the purpose of this video, maybe what I'll say is it requires us to be able to be patient enough to see the value in trying to understand what's going on and not trying to just fix it right away. Because if we're really impatient and frustrated with the pain and discomfort in our body, then we can kind of rush to want to just like do something, anything. And sometimes that just leads to this massive waste of time and potentially even like aggravating it, making it worse, or at best just kind of like being unhelpful. And so the first step to figuring out what your body really needs is to acknowledge that kind of there's a step one, which is gaining awareness and gaining understanding and learning for yourself, like, what shapes does your body make and what shapes does it struggle to make, right? Like that's like healthy movement is just opening and closing and opening and closing in like a whole symphony of well coordinated, well timed movements, right? But we can simplify it and say at any one spot we want to be able to just do both of those things. So how do you know if you're doing both of those things well and balanced and in good timing? Or how do you know if you're kind of just like stuck in one spot, right? The first step is that you have to take that on as a project to build your understanding and build your awareness. And then from that place of clarity and understanding, then you can make well-informed, well-resourced, well-empowered decisions on your own, and you will have a system and a process by which you can kind of confirm if you're making the right choice or not, right? So in a perfect world, you've got a clear thinking of why something is bugging, why something hurts, and then you do something about it, And then you have a way to validate that, right? Did it work? Yeah, okay. So the long and short of this little tutorial here, my friends, is that stretching is not always the answer. We can overstretch and it is not helpful to our system. We do not want to be taking a stretched out rubber band and just stretching it further. Yikes, right? So, um, you know, another way to say that, which is kind of counterintuitive, is that sometimes the solution is that our body needs to compress. A lot of times, actually, we need to compress and close a certain area of our body, which a lot of times we think of that as bad, right? Like, oh, compression sounds bad. It sounds like something's getting jammed, right? So, but another way to say that, if you think of the rubber band, is that like, it just gets to have a little bit of slack. It gets to just relax a little bit, right? So think of it like that. So if something's overstretched and then we would actually want to compress it, another way of saying that is that we want to just kind of let it relax a little bit, let it have some slack, let it kind of unload and unwind and relax for a little while. Okay, so I hope that's informative. Please drop a comment below. I'm so curious how this is landing for you. What are your questions? What resonates? And this is really what I strive to give all of my clients and all of my students, especially my one-on-one clients. We're able to get a little bit more fine-tuned and detailed and in-depth with what's really going on with your posture. It's something that's very hard to teach in a group setting. So when my clients come in for one-on-one sessions, that's when I'm doing a lot more detailed assessments and kind of bringing the client along, bringing you along for the ride so that you gain that awareness and that understanding for yourself and hopefully leave the studio feeling like you have more clarity about how your body is moving and more clarity about kind of what's missing so that you can give your body back the thing that's genuinely missing in order just to restore that beautiful, balanced, healthy movement. Okay, that's what I've got for you guys today, this week. I will see you guys next week. And check out the link below if you're interested in booking. I've got a couple of time slots available right now. I've kind of got a little bit more space in my schedule than I've had for months and months and months. So this is a great time. The weather's getting bad outside. It's a great time to come into the studio and give your body some TLC. All right, bye for now.